Morning. My name is Dr. Hillel Mazansky, and I'm coming to you today from San Diego, California. My website is drmedicalhypnosis.com, on which you can find your own specific medical hypnosis video. Today I am going to talk about colorectal cancer. Colorectal cancer, folks, is the third most common cancer in the United States, next to breast and prostate cancer and skin cancer. We often see this cancer, and if it is caught early, you can save the people. Usually it begins in the large bowel, on the inner aspect of the large bowel, with a small benign knot or a polyp, as it's called. Some of those polyps are hyperplastic polyps and will never turn to cancer. But then there are the adenomatous polyps that can develop into cancer. It is usual around 50 years of age for the person to have a screening test via a colonoscopy, or now there's a newer version called the virtual colonoscopy, where a 3D CAT scan is done. The problem with this is that you get quite a lot of irradiation. So if there's a family history, we have to be more cautious. What causes the colon cancer? Well, as I said, one is family history. Two is age. People over the age of 50 usually get it, although we've had the unfortunate position to have seen it in a 22 and a 24-year-old person who had metastatic cancer from the colon. Then there is race. It is more common in the African race than the white. And one can prevent colon cancer by not eating a large amount of red meat, by exercising, eating plenty of fruits and vegetables, and taking a half an aspirin a day with permission from your doctor. There was an extremely large, well-done study published a year ago in the Lancet magazine. That's England's most prestigious medical journal. And it showed those people who took 71 milligrams of aspirin daily had a 40% reduction in colon cancer, pancreatic cancer, some breast and prostate cancers. Anyway, there was a marked reduction mainly in the colorectal type. But before you venture onto this, please check with your physician, because you might be on some medication that aspirin is prohibited. Taking vitamin D is extremely important. If you don't have the disease, start off with 5,000 D3 after food. If you do have the disease, it is recommended you take 10,000 units daily after your main meal and get your blood levels checked. The allopathic physicians are all very worried that it might be toxic for you. They've never seen a toxic case, and neither have I, and I use it extensively. So the whole idea of the detection is to detect it early and treat it. Now, what are the signs and symptoms of colorectal cancer? What do you see? Initially, you don't see anything while the polyp is there. Then you might notice some red blood in your stools. The blood becomes more frequent. You have abdominal pain and bloating. And in the later stages, you start to lose weight, etc. If the colon cancer is caught early, it is staged. The stage 1, when it is within the inner lining of the colon. Stage 2, where it is spread from the inner to the outer aspect of the colon. Stage 3 is when it is spread to the lymph nodes. Stage 4 when it is spread to the liver, lung, bones, etc. Naturally, the earlier it is caught, the better it is. If after surgery you tend to have a recurrence, then the recurrence is usually treated with chemotherapy. Those type of drugs are far superior today than what they were years ago. So it behooves you to be vigilant. At age 50, please go and see your physician and have them do a test that I've mentioned. Whatever they're doing, they do to make sure that you don't have colon cancer. Interestingly enough, colon cancer also comes in the families of people who've had breast cancer and prostate cancer. And as I said, to prevent it, you want to exercise a lot, eat properly, high nutritious antioxidant diet full of fruits and vegetables, exercise, take your vitamin D, take your aspirin, and be vigilant all the time. And I am sure you will not develop cancer, but if you do, you have caught it in the early stage, and that is helpful. Please, please do not ignore these symptoms which are abnormal and push them under the rug. If you do get cancer, our video on the treatment of cancer is self-empowering. We discuss hypnosis, how you can develop, how you can use this hypnosis to help treat yourself. We give you a highly nutritious eating program or diet, and we discuss what exercises you should do. If you are really extremely stressed out, then there is a separate video. But I would suggest you start off with a cancer video, listen to it twice a day, and you will be self-empowered to help heal yourself. My name is Dr. Hillel Mazansky, and I thank you for listening to this YouTube video health tip.